Assalamu alaikum viewers. Hope you all are going well. I'm Dr. Tamana Mahmoud Rupi. I welcome you all, and today we are in our thousand number session. This is the thousand number Medi-Live, and we are very much delighted to know to tell you that. And in this session, we are going to discuss about anti-aging treatment by hyaluronic acid dermal filler, and Dr. Rayhan Hossain is with us, who is a consultant dermatologist of Mano Aesthetics and Laser Center. Hello, Dr. Rayhan. Hope you are going well. Assalamu alaikum.
Walaikum salam. Hi everyone. Thanks to Meditalk and Lamon Aesthetics and Laser Center for arranging this special show. And today is a special day for Meditalk Digital as well. This is the thousandth session for Meditalk. Thank you everyone. Today our topic is about the hyaluronic acid dermal filler, and we'll discuss on this topic. Thank you, Dr. Mi.
Thank you very much. And dear viewers, I want to let you know that we are live on Facebook and YouTube. You can make your comments in our comment box because our comment box is open for you all. And we are waiting for your comments. Please ask us any question about aging process or anti-aging treatment. Ramano Aesthetics and Laser Center is with us and we are thanking them. Dear doctor, I want to start our discussion. And at first, I want to know how and when aging process starts actually.
Actually, aging process is a natural process. We cannot stop that process. Aging process usually starts from 25 years of age. Even after every year, what happens to our face as we age, we start to lose some important component from our body, like fibroblast. Fibroblast is one of the most important cell in our body, which actually regulate the collagen synthesis, hyaluronic acid, and elastin synthesis. And these components actually they are very essential for our body as well as the cellular matrix. As we age, the fibroblastic activity gets reduced day by day. In every year we lose 1% fibroblastic activity, and up to 25 years age, osteoclastic and osteoblastic activity, there is a balance in our body. But after 25 years of age, this balance get reduced, and bones to get resorbed. That's why we start to lose our bones as well. We start to lose our fat. There are two types of fat components in our body: the superficial fat and the deep fat. When we age, actually, in the upper phase, there are some particular changes. In the lower phase, there are some particular changes. Mostly in the upper phase, we start to lose our bone density. That's why it
If
is
you allow
bone.
me,
Yes.
I want to interrupt you. That what do you mean by upper face and what do you mean by lower face?
This is an imaginary line between the full face. If we divide the full face from the middle one, if we imagine there is a line in between the upper and the lower face, then we can divide the face into upper and lower. This is an imaginary line actually. You can think it's in the middle point of face, okay? So upper face, what happens to upper face actually? The bony density get reduced, and the deep fat pad that get reduced. That's why in the upper face, this bony fat and deep fat pad losses. That's why we start to get some hollow in the upper face. There will be the temporal hollowness. There will be some frontal hollowness. The cheeks get down, and in the lower face, what happens? The gravity is very important. The gravity is always pulling down our face towards the ground, and when we age, actually the elastin, collagen, hyaluronic acid, fibroblastic activity, this get reduced. That's why this an older face can't protect this gravity force. That's why the lower face, the superficial fat pad get hypertrophied, and you will see in an older face, the lower face gets the shape of triangular face because the fat hypertrophy occur in the lower part of the face, and hypertrophy or the atrophy occurs in the upper face. That's why a younger face is mostly triangular, but the older face is quadrangular. Okay, these are the changes due to aging process. And when we age, there are some other changes due to the photoaging, due to the ultraviolet radiation, due to the fibroblastic activity get reduced. So many things happening to our body, and we look like an aged person. And there are some hormonal balances as well, hormonal uh, influences there. Mostly the female patient and the male patient, there are some special hormone, the estrogen for the female hormone and the testosterone for the male hormone. This hormonal influence also make a change in our body fats as well, and contributes to our aging.
Actually, none of us want to look like a aged person. So my question was, at what age the aging process actually starts, and actually when we should start our anti-aging treatment? We can think about taking anti-aging treatment.
Okay, thanks for the question, Dr. Rumi. The aging process starts from 25 years of age. That's why if a patient starts the anti-aging treatment from the 25 years of age, he will be easily able to delay the aging process. As I already mentioned, that every year we are losing 1% fibroblastic activity, and that's why if we start the anti-aging treatment at very early age, we can delay the aging process really. And if a patient start the anti-aging treatment at 25 years of age, at the age of 40, he will not be looking like 40. People will think that he is in the age of only 30, but this is the magic of anti-aging treatment, which by which we can reduce around 10 years.
Okay, so that's the big question, that how long the magic will persist.
It depends actually what type of treatment we are giving to the patient, and there are different protocols as anti-aging treatment. We are doing mesotherapy, we are doing PRP, we are offering the hyaluronic acid dermal filler, we are offering the laser. There are so many treatment protocols as anti-aging treatment. It depends actually which treatment is we are offering to the patient, and whether he is the appropriate client for that treatment protocol or not. There are certain types of anti-aging treatment actually. It really lasts longer. It depends which treatment we are offering to the patient.
Okay, so and it depends on various factors. You were telling about that.
Right.
What do you mean by a filler? We are talking about the hyaluronic acid filler. At first, we have to know what we mean by filler actually, and then we will go to the hyaluronic acid filler.
Okay. As I mentioned, there are some protocols like PRP, mesotherapy, laser, and hyaluronic acid filler. There are so many components, but HA filler, this is the most important and this is the most famous anti-aging treatment in the world right now, because hyaluronic acid filler is we know from the word filler. Filler means it will fill somewhere, but there is a gap due to the aging or any other causes. If there is any gap, we can fill by this filler, and this filler is made of hyaluronic acid. So some people are become scary that what is hyaluronic acid actually? Is it an acid and it's going to make
The
some
word
problem in my face?
the word acid is the reason of the fear, right? So what
Yes,
do
I'm
you
going
mean
to
by
explain that one actually. So hyaluronic acid is a natural component of my own body actually. Our body is having hyaluronic acid already, and there are some particular places in my body where the hyaluronic acid concentration is really higher. In the vitreous, in the eye there is a fluid we call the vitreous, and in the vitreous there are hyaluronic acid concentration is really high. In the joint space there is synovial fluid. Hyaluronic acid is already naturally present over there, and at our body in dermal, I mean in dermis, below our skin, just below the epidermis actually, in the cellular matrix, the naturally hyaluronic acid is already present over there. But as we age, as I already mentioned, the fibroblastic activity get reduced. That's why the hyaluronic acid concentration as well get reduced. And it's not an acid, it's not going to make any harm to your body, as this hyaluronic acid which we are offering to your body, it's already taken from the natural source. This is actually one kind of carbohydrate. This is called the disaccharide carbohydrate. So we all are famous. You know what is carbohydrate, right? So it's a kind of carbohydrate, but in the gel form. It's viscous, it's crystal clear, and it's totally safe to the body. And mostly, as it is coming from the natural source, this is why it's non-allergic. Previously, there were more types of filler like permanent filler, semi-permanent filler, and this hyaluronic acid is the absorbable filler. The permanent and semi-permanent filler were used previously in past days But those permanent and semi-permanent filler used to cause so many complications, so many hazard to the human body, and there were more side effects. This is why those fillers are less popular in these days. Now we are using this hyaluronic acid absorbable filler, and hyaluronic acid absorbable filler has got so many beneficial effects to the body. When we inject the hyaluronic acid to the dermis of a skin, it helps to regrow the fibroblastic activity. It helps to produce the collagen. It helps to hydrate your skin because hyaluronic acid is hydrophilic. Hydrophilic means it has a tendency to bind with the normal body water. So when we are injecting into the body, it's binding with the water, it's holding the water. That's why that area will be more moisturized and that area will produce more collagen. It's an anti-aging treatment and it's going to help you in different ways. I'll tell you how we are using this hyaluronic acid in different parts of the body and what we do with this filler. This is magical treatment because other anti-aging treatments, it takes more sessions. If we treat any patient by laser, at least it will take 4 to 5 sessions to get a result. If we use the PRP therapy, 6 to 7 sessions are required. If we go for the mesotherapy, more sessions are required. But the hyaluronic acid, instantly it will work. If a patient visit to us, if we can identify what's the problem with the patient, if we can choose a better filler for him, and it takes only 15 minutes to get the result. After injecting this filler to the certain parts of the body, after 15 minutes, patient will get the full effect, and usually 100% patients are happy after getting the hyaluronic acid filler. I'm honestly speaking.
Okay, so dear viewers, several good news are for you. And one of them is we have hydrochloric acid in our body, in our stomach. That's the strongest acid. So that is beneficial for us. And hyaluronic acid is also present normally in our body. So nothing to be worried about the word acid. And Dr. Raihan has described a in a very good way. So our viewers are with us and they're asking questions. We have to take their questions. Dr. Rashid Raji
Okay.
has several questions actually. How long does hyaluronic acid fillers last? And does hyaluronic acid injections work for wrinkles? And he has another question. What should not a patient do after being treated with hyaluronic acid fillers? Three
Okay.
questions.
Thanks to the that person who made that question. I'm going to answer those questions. Hyaluronic acid, actually, I already mentioned that this is very highly beneficial for the body. And you mentioned about the wrinkles. You know, there are two types of wrinkle: the dynamic wrinkle, the static wrinkle. When a patient having a facial expression like this, okay, so after having a facial expression, if the wrinkles come on the forehead or any other parts of the body, it means the dynamic wrinkle, man, you are in motion. That time if any wrinkle comes, this is the dynamic wrinkle. But if you are not in motion, suppose now I'm not having any motion in the, I am not having a facial expression to my face, and if any wrinkles are visible over the forehead, cheek, or the crossfit or any other areas, when the patient is not in emotion, not in facial expression, if the wrinkles are still visible, these are called the static wrinkles. These static wrinkles must be treated with the hyaluronic acid filler because the static wrinkles will never go by using the botulinum toxin. Botulinum toxin is only used for the dynamic wrinkles because the dynamic wrinkles comes after the muscular activity, and the botulinum toxin acts on the muscles, that relaxes the muscle and reduces this kind of these wrinkles. But hyaluronic acid treats the static wrinkles. But if a patient is having the static and dynamic both type of wrinkles, mostly the aged patients like 45 plus patients, they have their static and dynamic wrinkles both are present in the same face. Then we should use the hyaluronic acid as well the botulinum toxin. And with the botulinum toxin and the hyaluronic acid, with this combination, we can fully reduce the wrinkles of any part of the body. Number two, the duration of the hyaluronic acid. As the patient asks how long it will work in the body after taking the hyaluronic acid, it depends actually. Usually, if you start the anti-aging treatment by the hyaluronic acid dermal filler, it takes around 1.5 year to even 2 to 3 years. But if the patient is more aged, like 45 plus, that For that patient, actually, it works a little bit less, but no less than 1 year. Sometimes it may work for 1 to 2 years, like that. Approximately 1.5 years, we mostly we get the result staying to the patient for more than 1.5 years, around like that. Okay. And any other question, Dr. Urmi?
And he had some another question. What should not a patient do? Should not do after being treated with hyaluronic acid fillers?
Okay, this hyaluronic acid filler, after taking the hyaluronic acid filler to any part of the body, you should avoid certain things. Like on the same day of taking the hyaluronic acid filler, you should not go for drinking alcohol. Number two, you should not go for any hot bath, because hot bath is going to destroy the hyaluronic acid which we already injected to your body. You can continue the makeup or any other things over the skin, it's fine, but avoid the hot shower, any hot compression, anything hot should not be applied to that treated area. And you should avoid the alcohol. And you can take rest on that day, actually, because after hyaluronic acid filler, the injection points a little bit swell, little bit erythema is there, so you should not rub that area, because that area is already injected and some kind of erythema is over there, and if you rub that area, that's going to destroy your skin for a certain period of time. And one more thing is that after having hyaluronic acid filler to any part of the body, suppose we have injected the hyaluronic acid filler over there, and that area should not be treated by the laser, because laser is going to destroy that hyaluronic acid filler. And these are the normal things which you should avoid after having the hyaluronic acid filler. Actually, hyaluronic acid filler is absolutely safe, and most things you can do after having hyaluronic acid filler. And any cold compression over the hyaluronic acid filler is absolutely fine. It's not going to harm you.
Okay, so you have told that patient can take a hot bath, patient can take anything hot. Okay, so if a patient is in a cold climate, then he has to take a hot bath actually. And so, what should you say in that situation?
In that situation, actually, the treated area should be avoided. Suppose we have injected the hyaluronic acid to correct the nasolabial fold. Okay, that patient can go for a hot bath, but this area should be covered by something else. That hot water should not attach to this area, the treated area. That patient should avoid that particular area only. On the whole, suppose we have done the filler in the face, but he can go for the hot shower in the body. Body, it's fine, and that temperature is not going to harm at the face. Okay, but the treated area where we have injected the hyaluronic acid, that area should not be attached with anything hot, because it will destroy that hyaluronic acid and the duration will be reduced. That's why it's better for you
Okay,
if you can avoid.
so if the hyaluronic acid filler is used in this area, then if the patient is restricted to take any tea or coffee or any hot things or soup.
The thing is that it's better to avoid, but even the forehead, if we use the hyaluronic acid to this area, which is not much closer to the mouth, then it's fine. But if we use the hyaluronic acid to the lip area, suppose one patient has got the lip augmentation by the hyaluronic acid filler, that patient should avoid the drinking tea and hot coffee or anything for that day only.
For
One day
the
is enough.
rest of his or her life, or for a certain period.
No, no, no. For the day only, when he or she has taken the treatment on that day only for 24 hours, not more than that.
Really, that's the good news.
Okay,
As
right.
so another viewer is with us, Dr. Nusrat. She is asking, which brands do you use for dermal fillers, and is it possible to treat dark circles by fillers?
Definitely. Thank you, Nusrat Jahan, for that question. That's a very important question, actually. To get the best result with hyaluronic acid dermal filler, what I already mentioned, that hyaluronic acid dermal filler is doing so many good things to your body. You need to go for the best brands all over the world. You should not go for any local brand, because the world best brands, they always ensure their molecules are better. Their molecules will act better on your face, and you will get the full result. So here in Lamon, even we are doing all the we are taking care of all these world best brands. See, this is the Restylane, and this is a very famous filler. This Restylane is famous for all over the world, not for Bangladesh even. Mostly the Europeans, American, all over the world they use this Restylane. Another one, this is called the Juvederm. This is another famous filler. This is widely used femur filler all over the world, and this is the chroma filler. So there are many brands all over the world which are really good to use, and you can use this kind of hyaluronic acid filler which is already renowned in the world, because the renowned companies always ensures their ingredients are working appropriately, and that's going to benefit you. And one more important thing is that, suppose I already mentioned the name of Restylane, that Restylane actually, as the hyaluronic acid is available in different viscosity. I mean, they can regulate the viscosity. Somewhere we need a very thicker filler, and some parts of the body we need a very lighter or a thinner filler. And Restylane, they are producing all kinds of these things. So with the same brand, they already mentioned which filler should be used to which areas of the body. Suppose if we want to augment the cheek area, then we should use the volume, because the cross linking and the G prime is high. I will explain you what is cross linking actually. Cross linking means the molecules are more tight and packed. So when the molecules are more tight and more packed and the G prime is high, means that will last longer. You got it. If we want to feel something, if we want to push from the below, suppose this is something. If you want to push it up, you need a harder thing. So to area, we use different kinds of viscous fillers. Suppose by the filler, we are doing the treatment of dark circle. We are correcting the nasolabial fold. We are doing the non-surgical rhinoplasty, which is called the liquid nose job. We are taking care of uh, the volume loss and marionette line. If there is any wrinkle over the marionette line, this is called the marionette line actually. When we smile, for the older patients, the wrinkle comes over there, and it's static wrinkle usually. This is called the marionette line. We can correct the marionette line by hyaluronic acid dermal filler. We can reshape the jawline. Some people are not happy with their jawline, so we can inject the hyaluronic acid filler over there, and we can make a good shape of this jawline. Nefertiti is a very famous character in Egypt history, and some people want to get the jawline of Nefertiti. This is called the Nefertiti line. And here in Lamano, I'm doing everything actually. Not me actually. There are some other doctors in Lamano also as well. They all are expert at doing all these things. And lip augmentation by the hyaluronic acid dermal filler is very famous procedure. Many persons or patients are there who are not happy with their lip, and we can augment the lip, we can volumize the lip, we can reshape the lip by hyaluronic acid dermal filler. And some people are there who are not happy with their nose shape. Some has got some um, bump over there. There is depression, and means it's not straight actually. Previously, the non-surgical rhinoplasty was famous, but these days, previously surgical rhinoplasty was famous. People used to go for the surgical rhinoplasty. They used to go for surgical rhinoplasty, and it makes the permanent change to the nose. But the problem is that if any patient doesn't like after the plastic surgery or the rhinoplasty, there is no chance of going back. This is why people are that rhinoplasty is not much popular these days. And now actually nose shaping by the dermal filler, hyaluronic acid dermal filler, is more safe, time consuming. Only 15 minutes is enough, and we can reshape your nose within 15 minutes. These all are the things what we can do with this dermal filler. And Nusrat also asked one more question about the dark circle. This is a very important treatment by hyaluronic acid dermal filler. You know, the dark circle, so many patients are there who are suffering with this dark circle. Some patients actually lost the volume over this lower eyelid due to the fat loss, and this dark circle will not go by any other treatment without having this dermal filler, because I already mentioned the fat loss can be replaced by the dermal filler. So if we use the hyaluronic acid dermal filler to this lower eyelid to replace the lost volume, dark circle will go away within 15 minutes. The quickest way to treat the dark circle. Thank you, Dr. Rumi. Any other question?
Okay, thank you, Dr. Nusrat, for your very effective session. And I have another question: that what procedure actually you follow to complete this HA dermal filler?
Before going for the treatment with the dermal filler, we choose the patient. We need to diagnose the patient. We need to exclude some diseases. If any patient is having any active disease, like any bacterial disease, any viral disease, or any, if a patient is having moderate to severe acne to her face, if the patient has any history of herpes simplex viral infection, if the patient is having chemotherapy, and if the patient has having any kind of connective tissue disorder like SLE, these patients should be excluded from having the dermal filler. So after before going to the treatment, we need to know the history from the patient. The patient is not having this kind of diseases. We ensure that this patient is safe to take the hyaluronic acid dermal filler. So we are judging the patient. We like to examine the patient. We take the history, then we prepare the patient for the dermal filler. No preparation actually required, but only the one important thing is that patient is capable to take the dermal filler, and he is capable to bear the cost of that filler because it's a costly procedure. And number two is that when we start the treatment, we clean the particular area where we'll inject the dermal filler, and we use a kind of anesthesia cream, any topical cream. Sometimes we use the nerve block to anesthetize the face where we are going to inject the hyaluronic acid dermal filler, and then we start the treatment. Hardly takes 10 to 15 minutes to finish the procedure, and immediately after taking the procedure, the patient can go home. He or she can continue her normal activity, and this is going to last long for more than 1.5 year or more.
And after that, it has to be done again, right? Am I right?
Sorry.
After 1 or 1.5 years, the patient
Right,
must
right.
go for consultation.
Exactly, exactly. So after 1.5 year, what happens actually? Why this dermal filler should be replaced after 1.5 year?
Okay, then.
Our body has got the hyaluronidase enzyme.
Yes.
When we are injecting the hyaluronic acid dermal filler to any part of the body or any part of the face, that hyaluronic acid will be destroyed day by day by the body hyaluronidase. This is the enzyme which actually destroys the hyaluronic acid, but it takes more than 1.5 years to destroy the full amount of hyaluronic acid we already injected to that area. And this hyaluronidase degrades that hyaluronic acid. That's why after 1.5 year we need to retouch the patient, but usually the retouch amount is less than the first treatment. Hopefully you got my point, right?
Uh, any follow-up treatment is needed within this 1 or 1.5 year.
Yes, follow-up should be that there should be follow-up actually. The patient should come to the treating doctor after 2 weeks, because when you inject the hyaluronic acid to a particular area, sometimes it takes to get fully activated within 15 days or 14 days. So what do we usually suggest to the patient? After 2 weeks, you should visit your treating doctor, because after 2 weeks, that hyaluronic acid filler is going to get settled to your body. It's very rare, but it sometimes happens. After having hyaluronic acid, there may be granuloma. Granuloma means some particular area may be thickened. There may be some kind of bumpy elevation. The place where we injected the hyaluronic acid filler, if it is not injected properly, but in skill hand, it rarely happens. So after 2 weeks, any patient come back with any granuloma or any bump which is not normally settled down to their face, that area should be neutralized by the external hyaluronidase enzyme. What I already mentioned, it's present in the body but in very little amount. But suppose we have augmented one lip, and that lip was over volumized, what the patient doesn't want. Sometimes patients ask that you have over volumized my face, what to do now? So this is why hyaluronic acid filler is really famous, because we can neutralize that one. Even if we overcorrect somewhere, we can use the hyaluronidase enzyme to reduce that bumpiness, to destroy that the extra hyaluronic acid. So we can back that one actually by the help of hyaluronidase enzyme. So we can take it off even. That's why hyaluronic acid is very famous in the present world.
Okay, very famous and popular, but you have already told that it's very costly also. So we are about to end of our session, and this is my last question actually. What about the cost and what about the complications?
Okay. People actually they want to know about the cost of the hyaluronic acid dermal filler. Hyaluronic acid dermal filler cost depends actually how much hyaluronic acid dermal filler is required for that particular treatment. Suppose for the lip augmentation, if somebody want to augment the lip by the hyaluronic acid dermal filler, it takes only 1 ml is enough, and that 1 ml may cost from 30,000 to 50,000. Actually depends upon the brand. If you want to treat your lip with the best brand in the world, it will cost more, it's normal. And if you consider the brand, the cost is going to down. And what I personally suggest, that you should go for the best brand, because that best brand is going to give you the best result, and you will be happy definitely. So do not consider about the money, but never consider with the brand in case of filler, because you are already spending so much money for that. You shouldn't consider the result, right? And this is the number one thing. And the complication, this is very important in case of filler. I already mentioned all the beneficial aspects of hyaluronic acid dermal filler, which is good, how it helps in our body, and how we are treating with the hyaluronic acid dermal filler, what treatment we are offering to the patient. I already mentioned all the positive things. There are some negative things as well, what we can't avoid even. And people should know what are the side effects of the hyaluronic acid dermal filler. In the expert hand, if the patient is going to the proper doctor, which doctor is absolutely skilled, who has got the training of injecting the hyaluronic acid dermal filler, and that doctor, if he knows the anatomy of the full face and he's aware of all the complications, it's very unlikely to having any kind of complication, except some, like that injection point might be a little bit raised, might be a little bit red, might be swelled, there may be a little bit pain. Up to this only, these all the things are get settled within 1 day. Within 24 hours nothing will be there. And on the following day, after when the 24 hour will be passed, the patient will feel that, oh, there is nothing. But in inexpert hand, there are more risks which can be happened. Like if the hyaluronic acid dermal filler is injected to any artery, means any vascular supply, that hyaluronic acid dermal filler may occlude that blood vessel, which may further produce necrosis, which is very dangerous one. And there are some particular danger zones in our face, like the glabella, this is the region. The nose, this is a very danger zone, tip of the nose mostly. So there are the 8 areas which we declare as the danger zone of our face. The doctor, treating doctor, he must know which are the 8 danger zones, and that's why a skilled doctor can avoid all the complications. But in inexpert hand, if he is trying with the dermal filler, he may blind the patient, I must mention it. And in expert hand, in if the doctor is skilled and he know all the things, if the brand is really good and the clinic is good and everything is fine, then nothing is going to happen. Thank you, Dr. Rumi.
Thank you very much, Dr. Raihan. Yes, expertise is necessary in case of filler. If you think of a filler, go to expert one, and Laman Aesthetics and Laser Center. They're for you. They're waiting for you with their benefits. And we are thanking Laman Aesthetics and Laser Center for their continuous support to us. And we are about to end the session, 1000 number session of Medi-Live. And thank you, my dear viewers. You are our inspiration, and stay with us. Assalamu alaikum. Thank you all.
Thank you.